My question is for Dr. Sims. I'd like to learn more about how to make those appliances. Can you hear me? I'm just wondering how to learn more about making the appliances that Dr. Sims is doing and help the patients where you're doing that.
Boy, that takes a whole lot of time to make the appliance, because you have to find the right vertical, you got to find the right AP, you got to fine tune a lot of lateral situations, their bite. It takes time, and the best way to put it is it's really a modified gelb appliance. Okay, if you modify the gelb, putting the patients in the right position, you can do it. You can do a lot of that stuff that you saw me do. But you got to find the right video first, and the right lateral, AP, all that kind of good stuff. One of these days, I'll have everybody be able to. I'll show everybody how to do this. You know, it's just, it takes time. It's not one size fits all.
Right.
And I've had people come to me and say, we can do this, we can do that, you know, and make it a mess, you know, mass production. Doesn't happen. Hasn't worked yet.
Okay. All right. Thank you.
You're welcome.
Okay.
Dr. Fletches, is 12.5 milligrams of iodine a good general supplementary dose for most adults?
Yes. It depends upon the size of the body. Also depends upon if you're trying to reverse disease. Like, let's say you have a woman with fibrocystic breast disease, lots of scar tissue and nodules and cysts of the breast. That woman might need somewhere between 25 and 50 milligram per day to help reverse the problem in the breast, and it takes about 5 years. If you're looking at getting rid of polycystic ovaries, then you're talking about 50 milligram per day. If you're talking about breast cancer, then we're talking somewhere closer to 100 milligrams per day. If we're talking about just regular routine day-to-day operations for the body, about 12.5 milligram. That's how much the Japanese are eating on a regular basis. Now, the Japanese at 13.8 milligrams a day of iodine have the least amount of breast cancer in the world. So we know what dosage of iodine works the best because the Japanese have taught us that lesson. So the Japanese, they have the least amount of all breast cancer. And frankly, when we look at breast cancer, we look at places like Iceland, Chile, other locations where the people eat lots of fish, and the intake of iodine is closer to that 12 mark. So 12.5 milligram, good choice.
Okay, how about children, maybe that didn't have benefits of mothers taking iodine?
There is the children, if you got Lugol solution, you can give them 1 drop per week. If there is, and you may question, did the fetal brain continue to develop after the baby was born? Dr. Ben Carson has taught us the following, is that we have children who will be born with seizures of one side of the brain, and you can take that brain and remove it up until about age 9, and they will be just a half a brain left, and then you can, and these children within a year will have full body control of the whole body because the other half of the brain that's still there is able to adapt and to help control the brain tissue, the whole body. So we know that the brain is still adaptable and is still able to change up until about age 9. the visual centers of the brain not totally mature until age 8 or 9 years old. So we know that iodine beyond the life of a fetus is crucial because we still got brain development going on, and that's where iodine is doing its work.
1 drop of Lugol's per week?
Per week for a baby that's out of the uterus. Lugol's is agitating to the stomach. And so if you give a baby iodine, you have to be careful with gastritis and vomiting and everything. So once a week should be enough. You know, that's all we got.
I enjoyed the presentations. I have no experience with MRI or cone beam technology, but I'm wondering, since 3D cone beam seems to be much more popular or available in dental offices, could it be substituted for the MRIs that you are taking, Anthony? Maybe Tom should answer that.
Actually, no. The reason is the X-rays or cone beams take hard tissue. So you will see bone, you will see teeth, all that comes about. MRI is a magnetic resonance, and that takes soft tissue. So you will see soft tissue, and what you have to do is you have to take both to put that, and you put them both together in your mind to understand what's going on. The cone beam cannot show where a disc is in place. It is impossible to do. You can see damage to the condyle. You can see damage to the glenoid fossa. You can see damage to the articular eminence, but you cannot see where the disc is. You cannot see if there's a perforation in the disc. You cannot see whether the disc is anteriorly displaced. You cannot see whether it's medially displaced, whether it's laterally displaced, anterior medially displaced, or posterior displaced. You cannot see that. I challenge anyone to do and to see that. They cannot. You will see whether or not the condyle is in a posterior, more of a posterior superior position within the glenoid fossa. And you know by neuroanatomy that the auriculotemporal nerve is behind that area. It feeds what is called the retrodiscal tissue, and that tissue there has a lot of blood vessels and a lot of nerves. And when it's compressed, it can cause all kinds of problems or maladies. So you literally have to do both to get an understanding of what's going on in that joint area.
This is for Dr. Sims. Sorry.
I love it. No,
All right.
I love the question.
My question is, after you get a person stabilized, and let's say you do some more, either you do orthodontics or have somebody bring the teeth back and do that vertical, what do you do for long-term stability so we don't get intrusion or activation of those muscles again? What's going to change? It could change put the whole ball of wax back in position.
What I do is I leave the patient in the orthotic for a minimum of 6 months to a year. By that time, the muscles have changed. You're not going to get much more of a change after that. Like I was telling you before, those African women with the lips, the discs in their lips, the muscle their lips are big, just basic muscles, and they change over time. And if you take those discs out, the lips just fall down because the muscle has changed. The same thing with the muscle here, the masseter, the medial pterygoid, the temporalis. All these muscles change so that the sarcomeres change in length. And once the sarcomeres change, then you're not going to get as much clenching or bruxism or whatever you want to call it, loss of VDO as you would. Now you change it, you hold it in place with the doing the orthodontics or the restorative dentistry or you leave them in the appliance. I find a lot of my older patients, my wiser patients, because nobody's old in my office. My wiser patients just want to leave it alone. Don't touch again. Don't touch it again, Dr. Sims. I'm good. I'll come back every 6 months because I know you can adjust it to wherever you need to be. I'm good. Don't bother me.
Hi, my question is for Dr. George Fetches. I wanted to know, when the kids are geniuses, but how do they do socially?
They're very good. They behave very well. In fact, I've met quite a few of you now, and many of you have grandkids or children where you took the iodine, and most of you have told me that the children are growing up just perfect or normal. We are lucky that we have one mother here who her dad forced her to take iodine for years and years and years. She went on to become pregnant, had a child. She's now 70 years old, and her son is 49. And I'm going to ask her to come forward and just give you guys a summary. I can give you the summary of a child that was 14 years old. This lady can tell you what her son is like at age 49 after her taking iodine through the pregnancy. Come here.
Yes, my dad was an MD. He specialized from Colombia in New York. And when I was pregnant with my son and my daughter, Daddy was giving me iodine. I didn't understand why then. But my son, his IQ is, Wayne was telling me, it's 160, you said? And anyway, he finished high school at age 15. And then he went to med school, and then in the middle of med school, he went to seminary. Anyway, he has a master's in seminary. He has 5 specialties in medicine, and he is a special forces trooper, whatever, what do you call them when they drop down from planes? Bronze Star, and now he's running in a government thing too, and head of in the hospital of the emergency, and so many things. He cannot even say, and he's an opera singer, and all that stuff, and he cannot sit still because I believe I didn't understand it until he talked today, and I thought, that's what's wrong with my son. And I was telling him, even my daughter, also I was taking iodine then, and Sandy, she would tell me, Mom, can you check to see if I'm doing my, she will give me her book, so I will see if she's saying her things right, and then she would say, Mom, there was a period there, you didn't tell me, there's a comma there. So anyway, she had photographic memory too, and all that, and great in music. So now I understand why these kids were like this, and now his son, Josiah, is the same. So now we know why. I had no idea. I grew up on the Mediterranean. I see too, all what we ate is fish and plus iodine. So that's what's going on. Now I understand. Thank you so much for letting me know that.
Basically, these kids are phenomenal children. The one that we have that's 14, her grandmother was trying to teach her music, And so before Grandma would leave with the assignment for the next week, the kid would sit there and say, "Grandma, could you play that song one more time for me?" And then take the whole week to learn the music and then play it perfectly for grandmother. Well, the mother of the child sat there and said, I don't see this kid practicing with the music in front of her. And what was happening is that at age 10, this child was practicing her music, but when Grandma was sitting there playing the music for the next time, the child memorized the whole music and then sat there and picked it out until she played it perfectly for Grandma a week later. So she was not able to, she was able to do things with music. She was able to do things by memory. Their memories are phenomenal. We just have no idea how good the brain can become in the presence of taking iodine. But what I've seen so far, these kids are all behaving the same way. So, and we have a couple here. There's a doctor here from Sanford, Florida, and his wife took iodine when she took in vitro fertilization, and they ended up with a pair of twins, and the twins are behaving just like Dr. Palmer's grandchild, and the stories just keep on going out of you guys, but I'm telling you, you've not seen anything as to what these children can do. And I think, her son at age 49 is demonstrating for us how much that human potential is there.
Dr. Fletcher, this is also for you. This one? Okay. Thank you for all your presentations today, by the way. Dr. Fletcher, this is for you. So, could you please comment on supplementation with iodine in the case of Hashimoto's? Any contraindications, controversies, dosage?
The issue of Hashimoto's thyroiditis, it's a problem where there are antibodies that develop against the thyroid, okay? And there have been researchers galore who have given iodine to animals to induce Hashimoto's thyroiditis. Never have been able to induce Hashimoto's just to give iodine to an animal. You have to, how do they induce it in animals? You give the iodine plus a goitrogen plus iodine, and that's how you develop problems with Hashimoto's. Flip side of the coin is that we have seen Hashimoto's in pregnancy due to a selenium deficiency, and if you give selenium to patients with Hashimoto's, the antibodies go down. The one thing we did not appreciate was the fact that you need zinc in order to convert thyroid T4 into T3. It's not just selenium. And then we had a study come out of Turkey just a few years ago showing that people, they normalize all the patients for the amount of iodine they were getting and this and that and so on. And what they did is they then looked at the amount of zinc in the individual, and they found that zinc deficiency correlated with thyroglobulin antibody production. So treatment of choice for Hashimoto's thyroiditis, number one, selenium, 400 microgram per day, zinc, 50 milligram per day. And because of taking zinc, you need a little bit of copper, so you need about 2 to 4 milligrams of copper, because zinc inhibits the absorption of copper. And so you want to put in just a smidgen of copper into that system. And that generally will bring down the antibodies, just giving them zinc and selenium. And so it's been done already.
So then there is no need for an iodine supplementation in that case? Or if there is some from a food source like kelp, algae, that would be okay?
You do need iodine. I want you folks to notice something about what she's doing here. She's focusing in on the thyroid. The thyroid contains only 2% of all the iodine in the human body. If a person is, the skin contains 20% of all the iodine. The muscles, 32% of all the iodine. The fat tissue in the body, 35% of all the iodine. Do you need iodine if you have Hashimoto's? Yes. And it's not just for the thyroid. We're not trying to feed only the thyroid. We're feeding the whole body. This is called holism. We're treating the whole person. We don't treat just the thyroid. So do you need iodine if you got Hashimoto's? You bet your bottom dollar.
The same as the 12 milligrams a day for maintenance?
I would go with that, yes, because the main issue is you're trying to treat antibodies. If you're trying to treat antibodies, you need selenium and zinc. It's not, you need iodine, but you need the iodine for all the other tissues that are, iodine dependent.
Thank you. I really appreciate that because I have spoken with some integrative MDs who have really been on the fence about iodine supplementation for Hashimoto's, and because they're just so afraid of a controversy about it. So thank you for mentioning the research. I'll look into that.
I wrote a paper a few years ago. I really looked at this, and the key point was you can never induce autoimmune thyroid disease in animals just by giving the animal iodine. Never. But you've got to take the iodine and give it with a goitrogen, and then you get into problems. So, give me the names of some goitrogens that are out there on the market. Cruciferous vegetables, such as?
Cabbage.
Broccoli?
Cabbage, kale, broccoli.
Kale. Do you see what I'm saying?
Cauliflower, yeah.
Cauliflower. Those people in the Amazon, 40% of every native that lives in the Amazon, 40% of those people have goiters. 7% of all the people in the Amazon are born cretins. And you need, and the problem is those people are eating a product called cassava. Another name here in Florida is called yucca. Yucca contains a goitrogen. And that goitrogen is a major source of problems, especially down there. They eat yucca 3 times a day. And in Central Europe, they eat a lot of cabbage. And the cabbage has a goitrogen in it that causes problems. So there's a lot of goitrogens out there. There's goitrogens in cigarette smoke, in tobacco. And these goitrogens, so you can see how ubiquitous goitrogens are. And if you give iodine with a goitrogen, you may develop problems with Hashimoto's thyroiditis. Don't let that be the only guiding force as to why you can expose somebody to iodine. You need iodine for a lot of other reasons in the body, okay?
Okay. Thank you so much. I appreciate it.
You're welcome.
Hello. I'm wondering if people are aware that Graves' disease or hypothyroidism can be induced by mercury. I published a paper on this.
With Graves' disease?
Graves' disease can induce autoimmune problems.
Right.
I mean, mercury can induce autoimmune problems, including thyroid.
Now, he brings up an interesting point. Is there another is there another way to induce the problems of autoimmune thyroid disease, Graves' disease, Hashimoto's, etc.? And it turns out that there is a master gene on the DNA called nuclear factor kappa beta. Nuclear factor kappa beta, when activated, and mercury can activate nuclear factor kappa beta. A virus infection called parvovirus B19 can activate nuclear factor kappa beta. Goitrogens can do this. Nuclear factor kappa beta is a master gene for inflammation. When that gene gets activated, there is problems with increased inflammation in the body. Now, when you have increased inflammation, you have an increase in heart disease. When you have increased inflammation, you have increased arthritis. You also have increased cancer and increase in autoimmune thyroid disease, whether it be Graves' disease or Hashimoto's. Now, what's interesting is that people who, and the Japanese published this probably about 15 years ago, people who develop Hashimoto's thyroiditis will have an increased risk of development of breast cancer, will have an increased risk of development of arthritis and so on. Why? Because it activates nuclear factor kappa beta. Mercury can be one of those sources. Now, what he didn't say is that if you take iodine has the ability to chelate the mercury out of the body, and I've seen it repeatedly on urine samples of patients that we've checked. So iodine is a treatment for getting rid of mercury inside the body.
Well, thank you.
You're welcome.
Do we have any more questions?
Looks like no more questions. So folks, it's time to go party.
Thank you very much to our speakers.